And what about gum and teeth and mouth health?
Well, this is
Because
great. This is what I know. And this is one thing I do know, right? So the interesting thing is, and this is a very complex subject, I guess, for people, even biological dentists, a lot of them get this wrong. They see disease in the mouth. They understand how to diagnose disease in the mouth, inflammation. I will tell you that the statistics that were published in 2008, I think, show that approximately 92% of US adults, I guess it would be worldwide, US adults have some kind of gum infection, even though it's slight. You know, if you're a woman and you're doing your hair in a mirror or putting your makeup on, or you're a guy shaving and you're using a mirror, and all of a sudden you saw a drop of blood drip out of your ear, would you be concerned?
Yeah, of
Most
course.
people would.
Mm.
Most people would be concerned. But they seem not to be concerned if they're brushing and it's a little pink, or they spit out the toothpaste and it's a little pink, or they floss and they see a little bleeding on the floss or between the teeth. And when you go to the dentist and you get your teeth cleaned, you ask the hygienist, how are my gums? What do you see? She said, oh, it really looks good. Just a little bleeding between these two molars. A little bleeding between the two molars is infection. How pregnant is pregnant, right? You have bleeding between the gums, it's just a little bit, you have active gum disease. Is it severe? Probably not. Is it something to be concerned about? Well, if your ear would bleed, would you be concerned? It would a drop of blood come out of your ear canal, would you be concerned? I would be. So if a drop of blood comes out of the gum, which should never, ever, ever bleed unless you cut it, I would be concerned. Scrub your nails with a scrub brush and you see droplets of blood forming where your cuticle is. Would you be concerned? You should be. When your gums bleed, you should be concerned. And where does it come from? It doesn't come from your mouth. It comes from your gut bacteria that is out of balance, causing inflammation and causing the immune system to respond. The immune system creates an acute inflammatory response, and then it keeps going on to become chronic. It gets into the bloodstream. LPS, lipopolysaccharides, get into the bloodstream. All of that travels to all mucous membranes in the body, one of which is the mouth. In the mouth, the bacteria garden, which is about 700 friendly bacteria or homeostatic bacteria, then get out of balance. Dental plaque, for example, is healthy.
No, I wanted to talk to you about that. We had a conversation about that once a long time ago.
It is healthy.
How do you know when it? Yeah, how do you know when it's not healthy?
When the gum is inflamed, it's not healthy. When the gum bleeds, it's not healthy. That's for sure. So most people have unhealthy dental plaque because 92% of the people have gum inflammation. So 92% of the people, to me, means they have some form of gut dysbiosis because they're eating a junky diet. Most people in the United States, most people I know, most doctors I know, I have never seen a doctor in my chair as a patient that does not have gum disease. Every medical professional that I have seen in my chair has had some form of gum disease.
Interesting.
Very interesting.
And that can bring us back to the honey and cleaning your teeth with honey.
So honey is so interesting. Most people think honey is sugar, but it's not. There are over 180 biologically active chemicals in honey. That's been documented. There probably are many more that have never been identified. Honey has a very reparative and healing potential. It's used for sores and all kinds of things outside of the body. Like I said, it has been studied with double-blind studies to use for oral mucositis. It's good for people that have xerostomia, dry mouth, because it's a humectant. It holds moisture. But honey, when you're brushing and cleaning your mouth with it, it's the perfect toothpaste if you want to use a toothpaste because it doesn't cause tooth decay. When it is in the mouth, it does cause an acid drop below 5.5, but it immediately goes back to a pH of 5.5. If you had a sugar product, it falls way, way down the acid realm and stays very acidic. Honey has been shown with double-blind studies with kids that have orthodontic bands and wires. Compare it with cleaning their mouth with a regular toothpaste or honey. Honey does extremely well. And it kills some of the overgrown bacteria that cause tooth decay and gum disease. So it is a very, very good toothpaste to use. Has to be raw, can't be processed honey, but it's a very good toothpaste. But you don't have to use a toothpaste. There's no reason to use a toothpaste. Just water and a soft soft bristle brush will clean your teeth. Cleaning between the teeth, little brushes that are like baby brushes, but they're tiny, tiny. One brand is called TP. It's spelled TEPE, Soft Pick. These are fantastic brushes to clean between the teeth. Dental floss is okay. I don't love dental floss because most people use dental floss under the gum, and when you saw it under the gum, you cut the gum and create a lot of other problems. Floss is good to remove food particles between the contacts of the teeth, but these little brushes that you clean between the teeth, these TP soft pick brushes, are ideal to remove the heavy dental plaque. It never removes the plaque completely, but it removes any excess plaque, and it's very efficient. If you get any bleeding when you're using that, it should tell you, I have gum disease. Now I need to get my gut healthy and maybe see a dentist to see how severe it is. If it gets severe and it gets under the gum and breaks down the bone, it becomes a very aggressive disease called periodontitis. 47% of US adults have periodontitis. If you're over the age of 65, that jumps to 70%. It's an epidemic in the United States. And this disease, unfortunately, when it gets under the gum, gets into the bloodstream. It gets into the lymph tissues. It even travels through the myelin sheath of nerves to get to other parts of the body. The very virulent bacteria, periodontitis, called P. gingivalis, can actually embed itself in blood cells and become dormant and travel the body in blood cells like a carrier, like a vessel. Like a boat, and then when it gets deposited in other organs, it can re-energize itself and become germinate as a very aggressive, virulent bacteria, and it gets into other organs. That's how it probably is happening in with cardiology problems, cardiovascular disease, maybe Alzheimer's. It can travel that way. It can travel through the bloodstream in a variety of ways inside blood cells, in a dormant state. It can be very aggressive, but you have to get a healthy gut as well as a healthy mouth, because the gut keeps leaking into the blood system, and the mouth keeps leaking into the blood system through this infected dental pocket. So both things have to be treated. You can't just treat the mouth with all kinds of antibiotics, which is unhealthy, and not treat the gut.
Very interesting. And you and I had a conversation once about teeth whitening as well. Any comments on that?
Yes, well, tooth whitening in a dental office is not going to cause many problems. It'll soften the enamel a little bit, but it then will harden, and it's not really a problem. Here's the real problem with tooth whitening. People get these trays to take home, and they have a gel that's very high in peroxide, hydrogen peroxide, and they use these trays every night because they want their teeth pearly white, which is not normal, by the way, and it looks very unnatural, but some people like pearly white teeth. And to get them and to stay that way, they have to bleach them every night with these trays. Well, here's a study that was done a couple years ago, very interesting study. In humans, they were using trays for a period of several hours. I can't remember the length of time, but every day for, I think, maybe 2 or 3 weeks. And they tested their blood for oxidative stress before they were doing the trays, and then 3 weeks or whatever afterwards. And it turned out that they had high levels of oxidative stress in their blood that were reminiscent of a person that had a heart attack. Now, what that means is that the hydrogen peroxide is leaking into the blood system and or the gut. It leaks into the blood system because it gets into the periodontal pocket and it goes that way. Or you swallow some of the excess hydrogen peroxide that's in the tray and it gets into your gut that way. And it's a very high concentration of hydrogen peroxide that is very damaging to the cells, and it creates oxidative stress by creating free radicals, and it doesn't do what it's supposed to do. In small quantities, hydrogen peroxide is very beneficial inside cells. When it gets overwhelmed, then this oxidative stress damages the cell, could kill the cell, and does damage the gut. So using a whitening tray at night, every night for a long time, can be a health hazard that people don't realize. If you're going to use a tray, maybe use it occasionally, but not on a regular basis, because some people just don't like teeth that are not pearly white. And even if you get your teeth bleached, they're not going to stay that color because it's not natural. Just eating foods will color the teeth. If you ate blueberries and ate chocolate and drank coffee, it's going to stain the teeth a little bit, and it's going to change that pearly white to a duller look. And some people don't like that. They want art to artificially make it better. One way to whiten your teeth in a more natural way is to use an electric toothbrush or a regular toothbrush and make a thick slurry of baking soda with some water. Or you can actually take baking soda with crushed strawberries. Strawberries have an acid called malic acid. Take strawberry and baking soda and crush them up and mix them together to a real thick paste, and then scrub it on the tooth surface, not at the gum line because it'll be caustic and irritating the gum, but just scrub it on the facial or the lip surface of the teeth, and it will help whiten the stain. And you could do that on a more regular basis without causing any oxidative stress.